The term for the pain is called as Vedana. Vedana is a word for pain. And Sthapana. Sthapana is a word which is used for re-establish. So, what Ayurveda does not target on reducing the pain. What Ayurveda targets on re-establishing the pleasant feeling of well-being. So this is what a pain management. There are various ways of relieving the pain, re-establishing the good feeling. It's not only medicine, but there are many other ways. But the key factor, the key target dosha is why we have to always remember key word that the pain is always due to vata vitiation. Whenever there is a pain, you have to consider vata. Anything which alleviates, normalizes, controls vata will relieve pain. But when we say that vata, we have to again remember why vata, because it controls both sensory and motor functions in the body. If we look at how the pain is originated, this is true. If there is injury, mechanical, chemical, then the one pathway is histamine release. Then the second is nerve ending, through that there is an impulse that through nerve roots, then it goes to the brain where there is in the thalamus there is a pain feeling, and through the spinal cord, motor nerve, that pain is felt at the body level. As everybody knows that Ayurveda, it is 3 dosha and 7 dhatus. Yeah, but we say that pain is felt due to vitiation of vata. But vata vitiation in rasa, dhatu, vata vitiation in rakta, mansa, meda, asthi, majja and shukra. The pain feeling, intensity, type of feeling, that pain is different. So, even though vata is vitiated, but vata along with rasa, pain is different, hence the herb is different. Vata in rakta is a very intense pain. The herbs are different, like Tinospora cordifolia. We say that even in modern Western medicine also, it's a vascular pain, muscular pain, visceral pain, neurological pain. Similarly, we have to find out it's not only vata, but vata in which dhatu. That's how first understand the disease and then find out the herb. This is the concept. So when we have a question, what are the herbs which relieve the pain? But we say that rogam adau parikshe tato anantaram aushadam. That means know the disease first and then find out the medicine. So know the condition first. It's not only vata vitiation, but vata along with which dhatu. This is now second level. And then we can find out the herbs. Can anybody tell us 1 or 2 herbs which are known as analgesics, Ayurveda, which relieve the pain? Any name which you know? Yeah. Yes, Nirgundi. Nirgundi is useful in Mansa, Meda and Asthi. Vata vitiation, Mansa, Meda and Asthi. And not only herbs, but the pain management is done through many vata alleviating measures, like massage, fomentation, and many Agni Karma, Nasya, Panchakarma, various Rakta Moksha. When there is a vascular pain, vata in Rakta, only through the Rakta Mokshana or leech application, the pain is relieved. I have seen many patients, acute pain, with leech application pain is gone when Rakta is vitiated. It's not herbs, but the external measures or Panchakarma that relieves pain. Or pain with Mansagata Vata. Vata and Mansa is vitiated, the fomentation is the best management. Charak has given, Charak Samhita, 10 group of herbs are mentioned and for one specific disease conditions. And likewise, there are 50 groups of 10 herbs are mentioned for specific condition. So these are, which are those 3 groups? One which I mentioned is Vedana Sthapana. But here this very interesting, Charak category mentioned Sthapana. Sthapana is not to reduce, but to re-establish. So if we consider Vedana as pain and Sthapana is re-established, so how the pain can be re-established? But those herbs, those specific 10 herbs which are mentioned, those are specifically to re-establish normal and pleasant bodily sensation. It is called as Anukula Vedaniyam Sukham. So to re-establish Anukula Vedana, this group of herbs has this pharmacological effect to re-establish Anukula Vedana. So those herbs may not have analgesic anti-inflammatory effect, but the pathway is little the different, where they re-establish, the pain is gone and the Anukula Vedana is established. Then there is a second group of herbs which are called as Shula Prashamana. So Shula is aches. So of different, like abdominal ache, headache, then colicky pain, spasmodic pain. When there is a colicky pain, spasmodic pain, or muscular pain, these spasm, muscular spasm, colic is relieved by these herbs. Majority of the herbs, like you mentioned about the pipali moolam, ginger, all these having pungent taste, that is katu rasa, and hot, that is ushna virya, are usually considered as a Shula Prashamana. Basically, they are Amapachana. They have an Amapachana effect. For all muscular pain, Maunsagata Vata, these herbs are used. And there is another third group, which is called as Anga Marda Prashamana. That is, which relieves generalized body pain, body ache. Herbs to control pain all over the body. Yeah, because of ama or diffuse, there is always diffuse body pain, aches and pains, fibromyalgia, chronic fatigue syndrome. These are various conditions. More ama, these Angamarda Prashamana herbs are used. So one has to decide. It is not that one gugulu is used for all the conditions, one ginger is used for all conditions. But if you have to really hit the target, we have to find out which is vitiated and which herb is used from these 3 categories.